Greetings from Canada House, the home of the Canadian High Commission in the United Kingdom, located on Trafalgar Square in the heart of beautiful downtown London. My name is Janice Charette, and I'm Canada's High Commissioner to the United Kingdom. It's a real pleasure and great honor for me to be here today, and also a personal delight to be able to welcome Sir Mark Walport, the winner of the 2020 Henry G. Friesen International Prize in Health Research. It's a pleasure to welcome you here to Canada House today, Sir Mark. C'est un immense honneur et un plaisir personnel d'accueillir aujourd'hui Sir Mark Walport, lauréat du Prix international de la recherche en santé Henry G. Friesen 2020 à la Maison du Canada. This format is obviously not ideal. We would have very much preferred to be surrounded by Sir Mark's family, friends, and colleagues, and to be celebrating his achievements in a more fitting way. However, current COVID-19 circumstances prevail, and instead we're using technology to bring Sir Mark to you in a virtual format. The High Commission is delighted to be working with the Friends of the Canadian Institutes of Health Research to be launching this year's Henry Friesen Prize program. And our thanks go to Friends President Dr. Obi Angel for inviting us to join you in marking this very special occasion. This year signifies an important milestone for the Friends of CIHR and for the Canadian Institutes of Health Research itself, as they are both celebrating their 20th anniversary. The Friends of CIHR was established with the principal goals of communicating the benefits of health research to the broad public and attracting and supporting research trainees in their career development. The Henry G. Friesen International Prize in Health Research, now in its 15th year, was created by the Friends of CIHR to honor the exceptional leadership, vision, and innovative contributions of Dr. Henry Friesen, the brainchild and founding president of the Canadian Institutes of Health Research. This major Canadian Health Research Prize is awarded annually to an individual of international stature who best exemplifies Dr. Friesen's prescience, organizational creativity, and broad impact on health research and health research policy. I can therefore think of no better recipient for the 2020 prize than Sir Mark Walport, a well-known and esteemed physician, scientist, and health research luminary in UK biomedicine. Sir Mark's accomplishments are stunning in their breadth and impact on health research, innovation, and policy. His links to Canadian institutions and collaborations are also noteworthy, whether during his time as director of the Wellcome Trust, when he helped to structure the Structural Genomics Consortium, as Chief Scientific Advisor when he provided invaluable advice to Canada on the establishment of our own scientific advisory system, and of course, most recently, as the CEO of UK Research and Innovation, where the Canada-UK STI relationship has grown from strength to strength under his leadership. Sir Mark has also served on a number of our committees and advisory boards, such as the Gairdner Foundation and CIHR, to name just two. The Friesen Prize supports a major public lecture, typically in Ottawa, and additional visits to academic centres across the country with a focus on universities and research institutes that nurture graduate student trainees. Now, under ordinary circumstances, Sir Mark would have been introduced widely to the Canadian academic community, graduate students, young faculty members, and senior scientists, to leaders in science and policy, as well as to senior government officials. But as fate would have it, the COVID-19 pandemic has precluded international travel and thus delayed the in-person introduction of Sir Mark to the Canadian community. However, we hope that he will be able to conduct this program as soon as feasible in 2021. In the meantime, we're going to use technology to offset this setback. We're therefore pleased to welcome Sir Mark and invite him to give us a small prelude to his formal Friesen Lecture, which will be delivered in person in Canada next year. Sir Mark's comments will be followed by a virtual roundtable meeting, bringing together like-minded, eminent research leaders from Canada and the UK to discuss and respond with tributes and with comments. In this way, we can present the Canadian scientific and academic community with an appreciation of the extraordinary achievements of UK science leadership and the strength of its international collaboration with Canada. Finally, before giving the podium to Sir Mark, I would like to acknowledge the kind support of the Friends of CIHR's sponsors who will help make this prize possible, most notably the Canadian Institutes of Health Research, as represented by their wonderful president, Michael Strong, le Fonds de recherche de Québec, Santé, et notre ami Dr. Rémi Quérion, Quebec's chief scientist, the University of British Columbia's president, the terrific Santa Ono, and the University of Toronto, represented by Dr. Vivek Goul, special advisor to the president and provost. So without further ado, let me turn the podium over to Sir Mark. Thank you very much for joining us today. Over to you.
Thank you very much indeed, High Commissioner, and thank you for welcoming me to this magnificent High Commission building in Trafalgar Square at what is an extraordinary time. It's an enormous honour to receive the Henry G. Friesen International Prize in Health Research. The roll call of previous winners comprises an exceptional group of people, and it's humbling to join the ranks. And as the High Commissioner just said, I'm very much looking forward to my trip to Canada, and I suspect we will all be looking forward to that time because it'll mean we can travel again. So it's an enormous honour to receive a prize that is named after a hugely distinguished clinician scientist. And the name of Henry Friesen, the discoverer of human prolactin, immediately took me back to my very first house job in medicine at the Middlesex Hospital in 1978, when I worked for a very distinguished UK endocrinologist, John, later Sir John Nabara. The job could have been called the Ames Metership. A large part of the job involved 4 times each day pricking the finger of every diabetic in the hospital to measure their blood glucose with the aid of an Ames meter. And this was followed by the privilege of prescribing their next insulin dose. In retrospect, this was an excellent training in meticulous clinical practice and clinical pharmacology. It also reminds us of a key debt of many generations of clinicians and their insulin-dependent diabetic patients to Canada, and the names of Banting, MacLeod, Best, and Collip. Pituitary tumours were a major specialty of the unit, and in the days before CT and MRI scanners, managing vomiting patients who just suffered air encephalograms to visualise their pituitary tumours in grainy negative images was another important task for the house staff. Those vomiting patients are a potent reminder that some of the most important advances in medical practice during our working lifetimes have come from the worlds of the physical sciences and engineering. And the air encephalogram has been rendered defunct by modern scanners. And it was from pituitary samples from patients who'd had transsphenoidal hypophysectomies, removals of the pituitary tumour, that Henry Friesen was able to identify in women with galactorrhea cells with particular tinctorial characteristics that turned out to be the source of prolactin. And it was John Nabara, who was an excellent mentor, that advised me, with my academic intentions, that I should try to get a job at Hammersmith Hospital, the Royal Postgraduate Medical School. And it was there in 1978 that I met another senior house officer, a certain John Bell, who'd come from Canada, who received the Friesen Prize himself in 2009, and whom I've known and worked with for now over 40 years. The important message from these introductory comments is that there are many hugely important links between Canadian and UK biomedical science. And at this crucial time of global disruption, we must do everything that we can to foster and grow our deeply embedded relationships and shared values. I could use all of my 10 minutes in reminiscence, and that is certainly better than remonstration. But I move now to the core of my remarks. We're going through a major disruption, and disruption creates not only the opportunity, but the imperative for change. As humans, we tend to look through the very narrow temporal window of our own active lives. And for the medical researchers of recent generations, there's been one common denominator and 2 eras of research. The common denominator is that 20th century biomedical research has been substantially funded by the public purse and by industry, with a crucial additional role for philanthropy. Curiosity and a drive to discover new drugs, devices, and tests have been the name of the game. And sadly, in a way, it was 2 world wars that provided the driver and the imperative for discovery, be it how to deal with the physical trauma of war, the origins of plastic surgery, transfusion medicine, and many other things, or much worse, how to injure people more comprehensively with high explosives, projectile technology, nuclear and chemical weapons, the vehicles. In Canada, the National Research Council was established in 1916, and in the UK, the Department of Scientific and Industrial Research in 1915. The Second World War provided an even bigger stimulus to science and innovation, and an important legacy of the Second World War in the United States was the establishment of the US National Science Foundation, following the extraordinary visionary work of Vannevar Bush and his book Endless Horizons. So as a result of all of this, we are in a golden age for biomedical research. During the majority of the 20th century, physiology and biochemistry reigned supreme, to be followed by the current era of research dominated by molecular medicine, data science, and extraordinary analytical instruments, which continue to decode the secrets of health and disease. Most cancers have been transformed into chronic diseases. Public health measures, coupled with drugs such as statins, fibrinolytics, and interventional cardiology, have utterly transformed the landscape of cardiovascular disease. Polio has recently been eradicated from Africa by vaccination, and of course it is a vaccination that is going to be crucial in bringing COVID-19 under control, we hope. But all is not well. Planet Earth today houses about 7.8 billion people, compared with just 1.6 billion in 1900 and 2.5 billion in 1950. And this growth in human populations around the world is causing an array of demographic and economic challenges. We live for longer, but we're also ill for longer, which puts enormous pressure on healthcare systems. The waste that we generate, invisible as gases such as carbon dioxide and nitrogen dioxide, and visible in the form of plastics and other solid waste, is despoiling our planet with dire consequences for the environment and for other species. Chronic disease grows alongside malnourishment, causing both starvation and obesity. Clean water, sadly, remains a luxury for many. And as we all know to our cost, infection is ever present, both new and old. So Ebola, COVID-19, Zika, HIV, tuberculosis, malaria, and so many more. And of course, antibiotic resistance is a growing threat. So this is a time of huge disruption, and our response now will shape the lives of future generations and the fate of many species on the planet. Health systems are misnamed. They are, by and large, disease systems. Medical research is, by and large, disease research. Funders of health systems look to the marketplace to provide healthcare products. Similarly, funders of medical research look to a marketplace of medical researchers, offering enticing research for them to fund. But of course, in other areas of public expenditure, governments procure the products that citizens need, and some or all of the research that they deem to be important for the taxpayer, especially where national security and resilience are at stake, including infrastructure, telecommunications, and defence. So there is a question for medical research going forward as to whether there are analogous important areas of market failure. And in an increasingly woke world, the research endeavour needs to examine its own culture. Persisting and interlinked ailments include lack of diversity, hyper-competitiveness, bullying and harassment, lack of reproducibility of research findings, and pressure to publish or perish. COVID-19 has exposed a lack of resilience in public health systems in many countries. This infection has also laid bare the effects of social determinants on the expression of disease. Although pandemic infection is at the top of national risk registers, few countries had paid the insurance policy premium for national systems of preparedness to deal with a global pandemic. The job of universities, research institutes, and funders of research is to create the conditions that will enable researchers and policymakers to deal with the challenges we face. And of course, education is arguably the most important tool of all. Many researchers are frustrated by rising populism and political conditions around the world that seem inimical to tackling the health and environmental conditions of people and the planet. They can respond in two ways. More could become politicians and policymakers themselves. If you can't beat them, join them. But for the majority, they need to dedicate their work to providing the answers to key research questions that will provide the evidence needed to help policymakers and the tools that could help them to provide sustainable and effective solutions. That is easy to say, but what does it mean in practical terms? I think it means two things. Firstly, history tells us that we must continue to fund discovery research, because by uncovering the secrets of nature, we will discover unexpected things. So the new approaches to vaccine development at the moment follow some of the unexpected discoveries made over recent decades by RNA researchers working on plant and microbial diseases. But secondly, alongside the discovery research, we must use funding catalytically to encourage researchers to work together, to listen to discuss and refine and tackle the questions of policymakers, whether these be the transmission mechanisms for COVID-19 or how to measure environmental nitrogen dioxide emissions accurately and cheaply. Many of these are questions that can only be answered effectively by multidisciplinary teams. Response mode funding means two things. Firstly, it means funders responding to questions posed by researchers. But also, it means researchers responding to questions posed by society. We need collectively to look at the incentive systems that will allow such a mixed portfolio. So it's the employers that control incentives for employment itself, for career progression, and for promotion. And it's the funders of research that control the financial incentives, which provide the fuel for the research vehicle. There needs to be a big and urgent conversation bringing together all of the parties to work out a way forward. The research system is certainly not broken, but it is due an urgent major servicing. And diversity of views is needed to have the best conversations, and the UK and Canada are well placed to collaborate to catalyse some of these conversations. So thank you again, High Commissioner, for welcoming me to Canada House this morning. And I look forward to my visit to Canada as soon as possible and catalysing and working with you to have some of the really important conversations about the way forward for research and innovation at a time when it is absolutely crucial in biomedicine as in all areas of research and innovation. Thank you very much indeed.
Wow, thank you so much, Sir Mark. What a thought-provoking analysis of the current situation facing health research and a wonderful basis for the discussion to follow. To close, may I again congratulate Sir Mark for this truly deserved prize. I can't think of a better way for Canada to recognize Sir Mark's exceptional leadership in health research and in innovation. And also, on behalf of Canada, I'd like to say a huge thank you for all of Sir Mark's support, for your guidance, and most of all, for your friendship. It has been our absolute pleasure to work with you throughout your distinguished career. Pour terminer, permettez-moi de féliciter à nouveau Sir Mark pour ce prix vraiment mérité. Je ne peux imaginer une meilleure façon pour le Canada de reconnaître son leadership exceptionnel dans la recherche et l'innovation en santé. Et aussi, au nom du Canada, je tiens à le remercier pour tout son soutien, ce conseil et surtout son amitié. Ce fut notre plaisir absolu de travailler avec lui tout au long de sa brillante carrière. Enjoy your visit to Canada next year and please stay in touch. Before saying goodbye, I just want to thank the Friends of the Canadian Institutes of Health Research and in particular Dr. Obi Angel for all of their work in organizing this wonderful event and this amazing tribute. May I now introduce to you Nathalie Desrosiers, the principal of Massey College at the University of Toronto. And Nathalie is going to introduce the Roundtable.